Hello, everyone. I just wanted to welcome everyone to Stanford Care's monthly Community Health Talk series. My name's Steve Sust, and I'm your clinical assistant professor who will be moderating this session. I'm pleased to bring you this series of talks co-sponsored by Stanford Care, Stanford Health Library, and the Vincent V.C. Wu Memorial Foundation. I'm very pleased to welcome Dr. Huiqiong Deng, who will speak on facing adversity lessons learned from two studies on the impact of anti-Asian racism and the COVID-19 pandemic on Asian college students and Asian medical trainees. The COVID-19 pandemic and anti-Asian racism have disproportionately affected Asian communities, leading to increased discrimination, xenophobia, mental health struggles, and barriers to academic and career advancement among Asian college students and medical trainees. Dr. Huiqiong Deng will share the findings of two pivotal studies. First, COVID-19's impact on discrimination and racism experienced by Asian medical trainees. And then secondly, impacts of COVID-19 on Asian American and Native Hawaiian/Pacific Islander college students. Through these studies, we'll gain valuable insights into the unique challenges faced by Asian individuals and communities during these unprecedented times, discuss what we learned from the results, and what we can do better to support Asian American communities. Dr. Huiqiong Deng is a clinical associate professor of psychiatry. She's also the co-director of Stanford Mental Health for Asian Research and Treatment Clinic. In addition to a medical degree, she earned a PhD with a major in rehabilitation science and a minor in neuroscience. Specializing in the area of cultural and interventional psychiatry and addiction, her goal is to help each patient along the journey to achieve optimal health and quality of life. As the author of more than a dozen scholarly articles, Dr. Deng's work has appeared in Psychiatry Research, Psychiatric Annals, Restorative Neurology and Neuroscience, and other publications as well. Since she joined faculty at Stanford, Dr. Deng has received research grant support by the Department of Psychiatry's Innovator grant program and the Stanford Center for Asian Health Research and Education. Please join me in welcoming Dr. Deng, who I will now turn the floor over to.
Thank you, Dr. Sast, for your generous introduction here, and also a big shout out to Kier for the invitation to give the presentation today. Today, I'm going to talk about two study results on the impact of anti-Asian racism and the COVID-19 pandemic on Asian undergraduate students and Asian medical trainees. So first, I want to say I have no relevant financial disclosures, and then I'll jump right in to talk about the study background. So I want to start with some data here. Since the pandemic started, over 11,000 hate incidents were reported to Stop AAPI Hate between March the 19th of 2020 and March the 30th of 2022. So over this period of time, there were more than 11 incidents, and among those, 44.4% occurred in the peak year of 2020. Harassment was a major problem reported. And almost 1/3 of the parents were reported that they were concerned about their child being a victim of anti-AAPI hate or discrimination in undersupervised spaces and on the way to school. So I also want to mention a little bit about the organization Stop AAPI Hate, since I'm quoting their data. So the Stop AAPI Hate is a US-based coalition dedicated to ending racism and discrimination against AAPIs. So as the nation's largest reporting center tracking anti-AAPI hate acts, the coalition publishes data insights and research findings as it is experienced by our communities. So I have quite some data here pulled from the Stop AAPI hate reports. So this slide, I'm going to share a little bit more key findings from their reports. So Asian Americans who have experienced racism are more stressed by anti-Asian hate than the pandemic itself. And 1 out of 5 Asian Americans who have experienced racism display racial trauma, including psychologically and emotionally. Asian Americans who have experienced racism have heightened symptoms of depression, anxiety, stress, and physical symptoms. So, as a psychiatrist myself, I know how those can impact every individual's life. So, experience of racism during COVID-19 is found to be more strongly associated with post-traumatic stress disorder symptoms. And there are other trends in discrimination. Here I have some data showing that the youth were more likely than adults to be harassed at school. So which was reported at 16.7% rate, which was in contrast to a quite relatively lower rate at 1.8% reported by adults. And also online, at the rate of 16.7% compared to experienced by adults at 10%. Adults were present in almost half of anti-Asian cases, but bystanders intervened in only 10% of those cases, which I think is quite an alarming number of the contrast here. You see the big number here showing the incidence of the anti-Asian cases, but not so many people actually stood up to intervene. And another thing reported is that girls were 2.5 times more likely to report than boys. So speaking of gender, women are more often victims of violence. 1 out of 3 women experience physical violences from intimate partner. 1 out of 4 women experience severe physical violence, including beating, strangling. 1 out of 5 women experience sexual violence. And women students are often victims of violence. 13% of women students reported non-consensual sexual conduct. 41% experienced sexual harassment, and almost 25% experienced sexual assault, sexual misconducts. So almost 60% medical students and trainees have experienced harassment in medical training. And among those people, there was higher rate among women reported higher than men. And I was just talking about medical training, so I have some data here to show the intersectionality of healthcare profession. A review study published in 2019 indicates that burnout and mental health concerns affect 30 to 60% of physicians and residents. Residence training was shown to create the highest rate of burnout and as well as high rates of depression disorders and depressive symptoms. So another data is that health workers during the COVID-19 pandemic have reported an increase in mental health issues. So speaking of hate and mental health, hate has had a devastating impact on mental health. So among Asian American individuals who experienced a hate incident reported to Stop AAPI Hate, almost 3/4 of reported named discrimination against them as their greatest source of stress, even ahead more than their health concerns during the pandemic. And half of the Asian American and Pacific Islanders experiencing discrimination reported feeling sad, stressed, anxious, or depressed as a number. So those numbers are quite high here, as we notice, right? So which is a strong indication of the hate and a close relationship with mental health. And during the pandemic, younger adults and the racial ethnic minorities have reported disproportionately worse mental health, increased substance use, and elevated suicide ideation. So those I pointed out here, substance use and suicide ideation, those are severe symptoms of or severe issues or severe symptoms of mental health conditions. And during the COVID pandemic, AAPI youth have been severely emotionally impacted. So I have some numbers to show the specifics. So almost 3/4 reported anger, frustration, 60% reported disappointment, almost a quarter reported fear, and almost a half reported sadness and depression. So during the pandemic, almost 3/4 of schools reported an increase in staff voicing concerns about their students reporting symptoms of depression, anxiety, trauma. And almost 70% of public schools reported an increase in the percentage of their students seeking mental health services at school. So here I have a slide showing a study which was done, a quite large-scale survey study looking into the impact of COVID-19 on college students' well-being. They recruited more than 18,000 students on 14 campuses. And that was the survey was done in late March to May of 2020, which is pretty much like the peak time of the COVID. In this study, they found that 23.3 reported much more difficult, and 36.8% reported somewhat more difficult to have access to mental health care during the pandemic. So altogether, 60% of college students reported lack of easily accessible mental health care during the COVID. While the previous slide, we have some data showing that those folks are actually in high need of these services. So here showing the data that they even they wanted to seek help, but they don't have easily accessible mental health care. So this is another study published in 2018, which is a large sample study, also a survey study assessing mental health disparities. So this study also recruited a large sample size. In this case, was more than 43,000 college students of color. So among those was a mental health problem. Asian students had the lowest prevalence of the treatment, with roughly 80% of cases being untreated, and 23% experienced perceived stigma. And we know that stigma is a barrier to access mental health care. So here I have a table from SAMHSA. So by the way, SAMHSA is a governmental agency established by Congress, and SAMHSA leads public health efforts to advance the mental health of the nation. So the data here is a table showing any mental illness in past year. And the column, the left column here showing the data of 2019, and then the right column showing the data from 2020. So across all the age groups, among all the adults, mostly had an increase of the mental health illness increased from 2019 to 2019. Not surprisingly, this is also consistent in the age group of 18 to 25, so young adult. And this table here, so we can see that good news is that the younger adults in the age group of 18 to 25 were receiving more mental health services. So there's an increase you can see from 2019 to 2020. However, I have another red square highlighted in the Asian data. So looking at the race groups, so Asian is the only group which had decreased utilization of mental health care services. So with all that background, we carried out two studies. So I'm going to talk about this study first. So the COVID-19's impact on discrimination and racism experienced by Asian medical trainees. So the study, we set up a few aims to evaluate differences in rates of anti-Asian discrimination in Asian medical trainees before and after the COVID pandemic started, and also to compare social demographics correlates of anti-Asian discrimination experiences to describe the different types of discrimination experiences and their impact on Asian medical trainees. And lastly, but not the not last but not the least, compare the level of community and institutional support experienced by Asian medical trainees. So the study design was cross-sectional web-based online survey. Responses recorded on either 5-point Likert scale or in the form of yes/no questions. So pretty straightforward question formats. And we collected the data within 2 weeks, 4 weeks time in November of 2021. And the criteria to recruit participants were self-identified Asian adult medical trainees training in the US at the time of the survey, including medical students, residents, and fellows. So in the study survey, we included the questions on demographics information, experiences of racism. So we had 2 time points. So the survey was one-time survey. So, but we asked the question to have them to recall the information on prior to the COVID and also since the COVID-19 pandemic started, the setting in which racism occurred, the racism's impact, and on multiple different levels, including functional impairment, impact on training, change in behavior, and overall impact. And also we looked at, we included questions to ask the need for mental health care due to racism experiences, and also their support received from family, peers, community, and institution. So we recruited, we included 399 participants' data in the final analysis. So a large proportion of the participants were female. And in terms of this number, the proportion of a female was consistent, but slightly higher than the Association of American Medical Colleges data from 2020 to 2014. So that data showed it's ranging from 51% to 55% with an upward trend annually. So for the female medical students. And on the right side, you can see the sexual orientation distribution. So 71% were heterosexual, followed by 15% non-heterosexual. And in terms of the training status, around a little over a quarter were first or second-year medical students, followed closely by 20% of third or fourth-year medical student, and 20% were resident, 9% were fellows. So the most populated training region being the West, which was a little over 1/3 of the participants, followed by almost 30% of the participants were at the training in the Northeast, and 17% in the South, and 6% in the Midwest. So in terms of the ethnic distribution, so more than half was Southeast Asian descent, followed by 22% East Asian, 13% West Asian, 7% multiracial, and 1% South Asian. 1/3 were not born in the United States. This is consistent with a nationally representative study that found the proportion of non-US born physicians to be 29.1% among the total physicians pool in the United States. So we also carried some statistic analysis, and we found a statistically significant increase in the instance of microaggression, harassment, threats, and violence. And we also found a great proportion of participants suffered the impact of anti-aging violence during the pandemic period. So that was compared during the COVID period compared to before COVID. We also found a great proportion of participants experienced functional impairments due to anti-aging violence during the pandemic. They are also significant participants expressed concern about their family being a victim of the anti-aging violence. So almost 1/3 of participants reported a great deal or a lot, and 28% reported moderate level of concern. 44% of the participants endorsed changing their behavior in response to the anti-aging violence. We also found 17% of the participants were either considering seeking or were seeking mental health care due to the pandemic-related anti-aging violence. So I want to make a comment here. So because previously we shared some data from SAMHSA. So if you recall that table, I shared 2 tables from the SAMHSA. So in 2020, so 20.8% agents received mental health services. So as you see here, the 17% is obviously lower than 21%. And also this 17% were people either considering seeking, which means not seeking yet, or was actually seeking the mental health. So this number is concerningly high, relatively lower than the SAMHSA report. So the SAMHSA report was in the age for the agents in general. And also there's another study published earlier in 2007. So in that study, they found Asian American students reported more depression and anxiety symptoms compared to white American students, but they are the least likely of all racial ethnic groups to perceive a need for services. So in fact, mental health care seeking among Asian Americans is 2 to 3 times lower compared to whites. So this was also consistent with the SAMHSA tables I shared earlier. 44% of the participants in our study also reported that their training institutions' adequacy of the response to anti-aging violence was far short of expectations or short of expectations. So in terms of the support they received, we looked into where they actually received their support. So the proportion of participants who received a great deal or a lot of support reported 36% were from their family, 28% were from their peers, and 25% reported support received from their community. However, compared to those three numbers, only 6% reported from their institution, which is, compared to other numbers, this number is quite surprisingly low. Finally, I want to share kind of some of the from the findings what we have found. So the study this is a summary of our results. The study participants endorsed being impacted by the anti-Asian discrimination during the pandemic period. They have resultant functional impairment and behavior changes, but we did not find clear impact on their training. I think this probably need a little bit more longitudinal study to track the data. And most of the participants felt supported by their family, peers, and the community, but not sufficiently by their training institutions. So a large number of participants, so in our study is actually 44%, which is a significant proportion of the participants, felt training institutions' report was short of expectations. So next, I'm going to move on to study number 2. We looked into the impact of COVID-19 on Asian undergraduate students. So the aims of the study was to compare experiences of racism, mental stress, including anxiety and depression during the COVID-19 pandemic, to determine the prevalence and the different forms of racism, and also to address how the rise in racial discrimination is affecting Asian undergraduate students' mental health. So we used a similar design cross-sectional online survey study. We collected the data from February to March of 2023, and we included survey questions on demographics, mental health data. We used PHQ-9, which is depression symptoms scale, composed of 9 questions, GAD-7, which is a scale, self-report scale to assess the generalized anxiety disorder symptoms. And we included one question asking substance use. And we also included a scale named Brief PDQ-CV, which is to get a sense of the perceived ethnic discrimination. And we also included questions to ask about civic engagement and access to mental health services. So to recruit participants, they need to meet the criteria of self-identified Asian adult undergraduate students in the United States. At the time of the study, they were in the school for undergraduate study. So for this study, we were able to recruit a larger sample size. So we included 1,016 participants data in our final data analysis. So around 31% of participants were of East Asian descent, followed by 27.5% South Asian and 25.5% South Asian as well. And in terms of a native language, so other than English being the majority, which is consistent with the sample showing that 70% born in the United States. So the table shows here that the Chinese language being the top, which include the Mandarin and also Cantonese and other Chinese dialects, followed by Indian, which is Hindi plus Indian dialects here. In terms of university region, the most populated training region of the participants were on the East Coast, which was slightly over the more than the West Coast, followed by the South, and then the Midwest. For school year is ranked by the training year from year 1 to 4 or more by this order. So I mentioned we included one question on substance use. So the question specifically were, during the COVID-19 pandemic, have you started or increased the substance use to cope with pandemic-related stress or emotions? So almost 20% of participants answered yes to this question. And then in this slide here, you can see on the left, which is the PHQ-9 score, so which is the self-reported scale for depressive symptoms. So almost half of the participants reported a moderate to severe level of depression, which is the right 3 columns of this graph here. And on the right side, you can see the GAD-7 score distribution. So the data shows that 40% of participants reported a moderate to severe level of anxiety, which are the right 2 columns of the scores. So we also have some preliminary findings here. 74.7% endorsed the COVID-19 and or racism as contributors to their reported depressive symptoms. So a little over 70% endorsed COVID-19 and or racism as contributors to anxiety symptoms. So the brief PDQ-CV scores were positively correlated with PHQ-9 and GAD-7 scores. So this means the perceived discrimination was the higher the perceived ethnic discrimination they had, they reported a higher more severe depressive symptoms and more severe anxiety symptoms. So from this study, I think it's important for us to think about what we can really do to help with the situation. I mean, for both the studies, right? So we found some alarming data. There are a lot of work we need to do. So in the community, we need to promote active allyship. So commitment to organizing, mobilizing, and empowerment, learn strategies to add anti-Asian racism in our communities. Take a stand. Be an upstander. As previously, I had data showing that even there's a significant proportion of hate incidents reported, but only 10% actually got intervened. So we need to have more people to be upstanders, so can intervene when hate incidents happens. We need to support anti-bullying training, especially for youth. We need to support rallies, marches, help communities apply social pressure against hate. And what we can do in academic setting. So being advocate for anti-Asian racism, support Asian and minority student-led campaigns on campus, support education against discrimination, including bystander training, right? So as I just spoke about, we need more bystanders, but how, when we face those incidents, how can we efficiently and how can we really face it? Because as you can imagine, those incidents can be quite upsetting, and people face it can have different emotions, which can be very challenging. So I think the bystander training can be very, very crucial. and support hiring educators and staff of color. Make sure your institution responds to anti-Asian racism. Be conscious of the minority tax. Educate your department about the need for non-Asian allies to lead and address efforts against anti-Asian racism. So lastly, I want to thank CARE seed grant so that we can, the study was funded by CARE and also by two of our department Innovator grants of 2021 and 2022. And our research, especially the data analysis, were also supported by BIRD, CTSA, and NIH grants. Lastly, I want to give a big shout out to our research team. So on the right side, as you can see, the part of the team, actually, this is only three of them showing on the pictures here. We actually have a quite large group. I'm actually presenting from the East Coast in NYC tonight because I'm presenting at the largest psychiatry conference in the country. So American Psychiatric Association annual meeting is holding in New York this year. I presented yesterday, and I was very proud that we had two students presenting two posters at the conference. One is Kai Huang, actually not on the picture here, but she got a medical student poster award. So very proud of our team here. So that concludes my presentation. I'm open to questions.
Thank you very much, Dr. Deng. It's a lot of data to sort through, and I was just realizing some of the work that you reviewed from Stop AAPI Hate, 10% upstanders. It's very sobering. And I mean, we could talk ad nauseum about this stuff, but it was just really one of these moments that reminded me how important this research is and how important our voices are during these very difficult times. So thank you for all of the work that you've done so far. And just for the people in the audience, I know this is a little confusing, but there's a Q&A function down at the bottom that you can also use to submit a question. There's also some other questions that were submitted during the registration process. So I'll try my best to go back and forth between the two and try to stay organized. But feel free to use the Q&A and also try to monitor the chat also for any questions that come through. So let me start with one of the live questions we received. Just again, sharing appreciation for your work, Dr. Deng. What can policymakers do to help prevent the escalation of anti-Asian hate and other xenophobia?
Yeah, so this is a great question because as I mentioned in the last couple of slides of my presentation, really we did show a lot of data, but what does it mean, right? So we see alarming data and it's really pointing to the need for a change, right? So I think from policymaker perspective, it is important to enhance the reporting and the support services. So policymaker probably can allocate resources to enhance reporting mechanism, for instance, of discrimination and hate crimes, particularly in communities with high proportions of Asian and other marginalized populations. Additionally, policymakers can support the expansion of support services such as victim advocacy programs, mental health services, and legal assistance to assist individuals affected by xenophobia and hate crimes. And another thing I think is important to strengthen hate crime legislation, right? So the hate crime laws we need to enhance those laws to ensure that perpetrators of hate motivated violences and discrimination face appropriate legal consequences. This includes increasing penalties for hate crimes and providing resources for law enforcement agencies to investigate and also prosecute such offense effectively. And another thing, as educator myself, I think it's important to promote diversity and inclusion education. So if we can support initiatives to promote diversity and inclusion education in schools, workplaces, and communities, this include incorporating curriculum contents that really enhance the contribution of diverse communities, promoting cultural competency trainings for educators, and professionals, and support initiatives that foster cross-cultural understanding and empathy. So as I mentioned in one of my last slides, right? So we need allies, we need allyship. So AAPIs are not alone in this, right? So if we can enhance that, have more allyship in this fight, our force will be stronger. So those are a few comments I would like to, and yeah, answer that question. It's a great question. Thanks for asking.
Yeah, that was a great question. I agree with so much of what you said with regards to allyship. You know, this is the child psychiatrist in me talking, but in terms of like the school curriculum, you know, the idea of student-led grassroots movements like diversify our narratives, where you diversify the selection of literature available to the modern high schools and to advocate for something like that. It's just one of these groundbreaking moments that are well, not all that groundbreaking, but very humbling. The strength in our youth and the hope that I think we all carry in our young people, being able to exemplify what we're hoping for here. But certainly great topics in terms of the allyship and the restorative practices and the socio-emotional learning that you're talking about. So critical in today's day and age. Let's see. So trying to move back and forth here. One of the questions that we also have, you actually touched upon this. They asked whether you saw a marked increase in severe mental health issues and treatment amongst API students during the pandemic. And I wrote down slide number 25 next to this question for the person who asked. But I don't know if you wanted to talk a little bit more about that increase.
Yeah. So definitely that's a trend we have noticed in some of the studies in the literature and also from our findings of the two studies. And also specifically, I have a specialty in addiction. So especially the second study, I actually designed that question in going through literature and trying to find, because for the survey design, we don't want to overwhelm so survey participants with too many questions. So more like I instantly had 10 questions I wanted to ask about substance use, all that, right? So I went through literature and condensed into one question, right? So during the COVID, have you started or increased the use of alcohol or other drugs to cope with that, right? So that's because of my special interest in addiction. And alarmingly, almost 20% of participants answered yes to that question. So as I just pointed out, I already shared some data, which is on the increasing trend, and also alarmingly, I mentioned the suicidal ideation and also substance use. Those are the things alarming to me as a psychiatrist, as an addiction specialist. I do think, and also in contrast to that, right? So we have the lowest number among all the ethnic and the racial groups that lowest rates to seek for mental health. So I think is a big thing we need to as a psychiatrist and addiction specialist, I think is to, first of all, conquer stigma, right? So help our community advocate for destigmatizing of the mental health illness in general, including substance use disorders, right? So because if there's a perceived stigma, as I mentioned in one of the slides, is just a barrier for people to seek mental health care, including addiction care. So that's not only on professionals, but I think is a system issue. There is a self-imposed and also society-imposed stigma, right? So I think it's a big job, and if all the community members can pay attention to that, at least be mindful there is an issue, right? So we see the higher need, the increasing need of mental health care. But on the other side, people are not actively seeking help, right? That's alarmingly very concerning to me. So if we can all do our best as a psychiatrist, I'm here to advocating people to seek mental help, to get professional help. But also for the community, for the system, we also need to think about ways to deal with the stigma. Increase awareness, I think, could be the first step.
Yeah, so true. I mean, can count on I can count on my hand the number of times, my mom and dad talked with us about some of these topics, and the conversation never really being something that validates and supports and sort of moving towards that help-seeking attitude. And it's just one of these difficult truths for a lot of us in our communities, that we just don't talk about this stuff at all. And part of us destigmatizing things is going to require a lot of the cultural shift that we're looking for here. So very, very, very true. And it's a lot to do, but I think it does start with each and every one of us who are here and really getting to think about what can we do as individuals to sort of be the change that we're hoping for here. So thank you. That really appreciate your comment on that too.
Yeah, because I really agree what you just said. And as I mentioned, I'm at the APA conference, and I actually presented a study. We did a qualitative study to look into the AAPI substance use and recovery. So basically, in that study, we interviewed 20 AAPI participants with substance use disorder. So it's a qualitative study. So we interviewed them, each of them, for about 1 hour to ask them questions about their substance use history, their addiction development, and also their path of recovery. And surprisingly, and maybe not surprisingly nowadays, since we know more about the modern minority myths, it actually can serve as both a facilitator and a barrier to people to get substance use disorder treatment, right? So it's really a double-edged sword. So we have a lot of values. There was one quote I actually cited during my presentation. The client, the research participant, talked about not able to face the family not able to face the client's substance use, and kind of sweeping it under the carpet, saving face, which is an important thing in Asian culture. And another participant actually cited being honest, face the substance use, and that's how the client was raised as AAPI, right? It's a family value. So from the contrast I just quoted, right, those two participants, you can see one end is like saving face, really to hide it, not to talk about it. But the other participant citing being honest, that's the first step. That's what I mentioned, the stigmatizing, right? So that's the first step, is at least we can face it, at least we can talk about it. Then we can think about how to deal with it, right? So it can be very, very tricky issue, right? So we definitely have a very, how to say, very strong cultural legacy, right? So we are all proud of that, but being part of that modern minority myth, right? So we also have sometimes it can hinder our substance use disorder recovery, right? And how we can turn that to be facilitating to the recovery, including, I think, for substance use disorder and for mental health issues.
I'm glad you mentioned the model minority myth. That's actually one of the questions that I'm looking at in the Q&A window. The question asked, how do we tackle the model minority myth? That is a whopper of a question.
Yeah. So as I just mentioned, some of our work, we are thinking about that. And in yesterday's presentation, I actually had like almost like 10 slides a background information, and there are review study actually published quite a few years ago, and talking about the literature actually already showed the model minority myth was dispelled in terms of like substance use development, right? So as I said, it could be actually a barrier for people to get care for their substance use disorder. For example, saving face, for example, not facing it, sweeping it under the carpet, all that, right? So that's definitely adding the stigma, not able to face it. That's the first step of trying to conquer the issue. So, but they are also like a positive values, a lot of cultural legacy we want to, for example, collectivist, right? So there was actually a study I also reviewed in my presentation yesterday, talked about the Asian values can help with the passive coping and also active coping. So passive, I mean, avoidant. That's probably easier for us to understand being conservative part of the Asian culture. But what about the active coping part, right? So then the authors had an explanation for that, which is the collectivist component of the Asian value, right? So actually pro-social. So encourage people to seek to get help from the family members, from the community. So all those could be like I just said, model minority can serve as a double-edged sword too. And we just need to how to best turn it around to be facilitating.
Yeah, how to sublimate that, how do you create, how do you turn something into something very, very painful and dangerous and turn it into something constructive, at
Yeah.
least as a discussion point for all of us. And I hope young people are talking about that in schools. I'll definitely have to circle back with some of the kiddos I work with just to make sure this is getting covered. But certainly for the people in the audience, I really hope that these types of things are being discussed amongst the young people who are out there.
And also for parents, because a lot of our 20 research participants in the qualitative study I mentioned, we found that the education to parents could be could turn it to a facilitator. For example, educating parents about the neurobiology foundation of addiction development, because a lot of times people perceive it as a moral issue, right? So we don't really perceive it as a neurobiological disorder. So that's very eye-opening for a lot of people. Like clinically, when I see patients at the Stanford Hospital with addiction disorders, I sometimes cite animal studies, right? So if you feed them with alcohol, if you feed them with stimulants, if you feed them with heroin, right, the animals will go crazy. They will forget about food and water. They will chase after the drugs, right? So those foundation of neurobiology knowledge can give people like, wow, that's how addiction can develop in animal models, right? And the humans are more complicated than that, but understanding the foundation of the addiction development can help people to de-stigma, right? That concept, right? Destigmatizing the understanding the process of how addictions developed, and that could help us. Oh, okay, so that's a disease, that's a biological disease, right? And another thing, parent education, another important component is to educate those folks how to best support, because we know in addiction they are sometimes like surprisingly we found enablers in the family, right? So being a supporter, not an enabler, sometimes the line can be blur, right? So it's very important we educate parents to how to be a good supporter. So all those, like you mentioned, important to have for example, curriculum, all those in school, right, to educate our school members, also students, and also parents are a huge component of the recovery.
I mean, certainly, right? Parents are such critical, you know, members in the community, and I don't know, it's just really important that they get the chance to sort of think through how they talk with their kids and to, again, not stigmatize things, try to talk, well, try to listen non-judgmentally, right? And just to be able to start having some of these discussions, because when you just dismiss it with moral panic and hazard, that is all very, very judgmental. It doesn't create the kind of dialogue we're looking for, obviously. So being able to, again, start having these constructive narratives, very important. Okay, let me keep going with questions because they keep coming at me here. One of the questions is regarding the impact on college students in the data. Where there's significant differences across the different regions. For example, East Coast versus West Coast, Southwest versus Northeast, etc.
Yeah, so we have the data on the school regions, all that, but we haven't got a chance to look into that yet. Actually, that's a very interesting angle. So, when my students presented the two posters at the APA, they also got similar questions. So those would be the next things we will be looking at as a next step.
Yeah.
We definitely have the data. We can do the correlation analysis on those, which is quite interesting. Yeah, thanks for the comment, which actually is not, you are not alone. So we got other comments, similar questions, comments from the APA audience.
Okay, very good. Let's see. So I know, there's more questions, but it's 7:59. I think I'm supposed to be closing at this point. So we'll try to get to the questions later on, but just wanted to say thank you again for coming to present, and really appreciate everybody's time and attention on this. I want to try to stay on time since I'm usually not on time. So this is a good place for us to maybe take a pause.
Thank you everyone for joining us tonight. Thank you so much, Dr. Deng, for giving such an informative and meaningful talk. And thank you, Dr. Sass, for moderating. And thank you everyone for joining us. If you have further questions, please feel free to email stanfordcare@stanford.edu. We are happy to recircle the questions to Dr. Deng for answer for you. And also thank you again for joining us, and we will see you next time.